Without my wife, I wouldn't have made it. I'll be honest with you. She's the reason that everything worked out so good.
With his wife by his side, Keith Loring faced some serious health challenges in his 68th year of life. A battle against prostate cancer, which he won, and a home improvement accident he'll never forget.
Well, I was on the side of the house working on the shingles, and the wife was holding the ladder. And so she goes into the house, and she says, "Wait for me, I'll be right back." But I says, "I don't have to wait, I was done." So when I started down, the ladder fell over. It was an aluminum step ladder. And so I turned my head so I wouldn't hit face first. And so I had 9 staples in my head, and my shoulder hit.
That 4-foot fall and hit to the shoulder caused this tear in Keith's left rotator cuff. Rotator cuff tears are usually from shoulder trauma or repetitive movements like pitching or swimming. What happens? The tendon lying on top of the shoulder breaks loose from the bone. The tear can cause weakness, extreme pain, and on some occasions, the arm cannot be lifted. Keith tried a variety of over-the-counter pain remedies to soaking in a hot tub, but the pain just continued to get worse.
I could move it, but it was very, very painful. And if I laid on it or did anything with it, it wouldn't function. I couldn't sleep. I didn't sleep for like a month and a half.
And this is the edge of the tendon here. So that spur presses right on the tendon, particularly when you're lifting your arm up.
Keith turned to orthopedic surgeon Dr. John Cowin for help, but this surgeon's focus is not only on the operating room. During his 35 years of practice, Dr. Cowin appreciates taking the extra time with his patients to clearly explain medical conditions and treatment goals. He believes an educated patient is an empowered patient.
It's very important, I think, that people understand. One of the problems that we have in medicine is we have our own language, just like you do if you're an engineer or whatever. And I think it's important to be able to translate that language into something that people can understand, because the more educated they are, the better that they understand what to expect.
When it comes to small rotator cuff tears, Dr. Cowin points out you can repair these with arthroscopic surgery, which uses tiny incisions and a small camera. But in Keith's case, he was dealing with an unusually large-sized tear.
For the small tears, I will do them directly through the scope, but when they're larger, it's hard to get that way. So I make probably, what would say, there's a 3-inch incision, 3.5-inch incision, to open up so I can get down and see. Because the bottom line is, whether you do it through the scope, whether you do it open, it doesn't make any difference. What you want is that rotator cuff to be put back where it belongs and to work for you. And the key thing, especially with rotator cuff tears, is relief of pain. We don't do it to increase the motion, because there's no guarantee that you're going to be able to increase the motion. Now, obviously, you know, Mr. Loring, I mean, had a great result. And I wish I could say that everybody that I did had exactly the same result. But he's just such an enthusiastic guy. I mean, he's just fun to be around, you know. And he was ready to go from day 2.
In fact, after 2 weeks after the surgery, I was bowling. But don't tell the doctor, he don't know. See? But I just strapped my arm to my side, and I could bowl.
This guy wants to get back and do everything that he wants to do. You know, I mean, what you have to do with someone like him is you have to lock him up. You know, because if you tell him, I mean, he'll go do anything. It was like the story that he told about, I don't know, what was it, 2 weeks after surgery, he was out bowling and he tapped his arm to his side. You know, and 3 weeks later he was playing softball. Now, I never recommended he do that. He's afraid to tell me. But people like that, they have the drive to get better. They want to get better. They want to be able to resume their lifestyle. And, you know, that's basically what our goal is.
Another key part of Dr. Cowin's treatment regimen is the prescription of laughter. Listen to this funny moment.
Now, let me ask you this. Has your bowling gotten better?
No.
No. So then don't tell anybody that I did your surgery, okay?
No.
If your bowling got better, I would take credit, all right?
I got a 200 average, and I'm over
It's
my
hold.
head as it is.
Okay, I got
it's
you.
Holding.
Yeah, it's holding, right. Laughter is good medicine, too. So I joke around a lot with my patients.
And laughter is good medicine. Keith is back to bowling, softball, and simply enjoying life.
No, life is good all the time. Right? You have to learn your limitations and don't exceed them.
To learn more about living a healthy lifestyle, log on to cfhalliance.org, or to find a board-certified orthopedic surgeon with the Central Florida Health Alliance, call 1-800-889-3755.